Good afternoon, everyone. I am Conor Donnelly. I'm the Director of Data Cloud and AI Solutions at Healthcare IT Leaders. I've been in healthcare data and strategy for almost 30 years now. Been in the United States for 21 years, supporting a large number of organizations in a consulting capacity and also a leadership capacity. At Healthcare IT Leaders, we really try and support our clients in three ways, which is working with them on their plan and strategy as they move to the cloud to do a data analytics and AI in the cloud. We support clients through that implementation, and when clients are ready to go live, we support them in the operationalization of those solutions. I'd like to introduce Dane, who is one of our clients and with whom we've done some very exciting work.
Nice to meet everybody. Good afternoon. My name is Dane Hudelson. I've been with Sanford Health just shy of 18 years, all in data and analytics. Today, hopefully talking to you about some of our journey, specifically over the last 10 years from a more disparate data analytics department into a centralized group focusing on AI machine learning capabilities and cloud-based analytics. Pleasure to be here.
Thanks, Dane. All right, everyone. So we made you a promise in the invitation. So let's get into that. I think to give you some context, we're going to understand who Sanford Health are. We're going to look at their journey, and then we're going to kind of tease out some important questions about how do you make some decisions around your cloud project? Who do you bring to the table as part of that project? How do you know you're ready for data in the cloud, for AI in the cloud? What type of investment you're going to make? And then from Dane's perspective for Sanford, let's look at where they are today and where they're heading next with that work. Peter, over to you.
So we're just launching a poll here. We're looking to ask, where is your organization in its data cloud journey? We'll give everyone a second to respond. We did make it multiple choice, just given some of these could be overlapping. Just give it 1 second, and Connor, if you just want to review the results, and we'll move on from there. Still got a lot of answers coming through, so I'll give it a few more seconds. All right, I think we're good there. Okay, Connor, you should be able to see the results on your end.
Yeah, very, very balanced. I think we've got people everywhere. We had 25% people still on premise. A third of the respondents said that they were beginning their migration to the cloud. A quarter of the respondents said they had some infrastructure in place, but they're still focused on integration. 17% said they've already begun using the clouds for analytics and reporting with automated insights. A third of the respondents said that they're looking at governance, security, and compliance in the cloud, and 25% responded that they've already begun using the cloud for AI, ML, AI, and some real-time insights. I think that includes the ChatGPT. People will include them in that amount. So very interesting. A lot of people in a lot of different places here. So it'll be interesting if you have any questions as we go through with Dane, what his journey has been like.
All right.
Thank you, everyone who responded. Okay, I'm going to say this because Dane's going to say it. When he says 2 million patients, he really means 2 million patients, not an old database with 2 million names in it. I think, Dane, let's stress to everyone how large your system is.
Yeah, so outside the 56 hospitals, 288 clinics, approximately 5 years ago, we did have a merger with Good Samaritan Society of the United States, which brought in long-term care facilities as well as SNFs. We do have an integrated health plan, and through recent MA activity, that health plan has now grown to 425,000, 4,000 physicians, APPs, 10,000 nurses. We are largest rural health system in the United States. We would like to pride ourselves on the premier rural health center in the United States as well. We serve just over 350 communities, which covers approximately 320,000 square miles in the upper Midwest. The population within our footprint is about 5 million. So you see how spread out we are. Annual revenue of just about 11 billion, and all in just over 53,000 employees here at Sanford.
Dane, just for everyone's interest, because I think we've got a mix of people in cities and other healthcare systems. You mentioned rural healthcare. I guess explain that for people who've never been outside the city.
Yeah, so rural healthcare, we're an Epic shop. So out of those 56 hospitals, approximately 45 of them are Epic and on a single instance of Epic, which actually makes us one of Epic's largest customers with that single instance. But we are a mixture primarily of critical access facilities. It is a 10-15% of them. 15% are PPS hospitals, but there's different rev cycle reimbursement models. But we are scattered. These are brick and mortar buildings that people are having to travel hours to for their healthcare. So the delivery here at Sanford can be a little bit different. We have a large initiative and focus on our virtual care and ability to mitigate those travel and distances whenever, wherever possible.
Thank you. And I think just for everybody's benefit, I just wanted to make sure with context here. We can jump into technology very easily. Let's just remember that, we're serving patients too. I'll tee this up, Dane, and then hand it over to you. I think just kind of looking from our perspective, when we came in last year, it wasn't just one problem being solved. I mean, certainly there was one big item on the table in terms of legacy hardware, but I think it's an understanding, as Dane expressed it there, is you're solving multiple problems at once. When you're the guys that get the data and leadership wants answers, you're going to be answering a lot of questions at once. So Dane, let's tee it up like that, maybe to give a sense of what was the big item, but what were you also trying to solve when you moved to the cloud?
So our biggest item was we had really reached kind of that inflection point over the last decades, mergers, acquisitions. We had a focus on a HANA database. I wouldn't even call it a data warehouse, but we sort of reached its maximum capacity, if you will, without having to tier up. That, along with other products associated to it, VMware, other vendors, the price point just became something that we need to take and do a serious evaluation of cloud. So that's where the cost, scalability, we pride ourselves on an on-demand data strategy. Being a centralized data department, we build reports, we put them out there for end users to consume, provide data navigators to make that as easy as possible. But there are cyclical events and timing that occur within, say, monthly reporting, daily, weekly, monthly, where large volumes of data need to be processed. And we were just falling short of expectation. Outside the integration gaps, bottlenecks in performance, compliance with some of the older VMs and databases, we had to take a significant look at the cloud. Now, to be upfront, we've been cloud hybrid for the better portion of 7 or 8 years. My data science team, we've been an AWS partner for 7 years now. This initiative, working with healthcare IT leaders, was really more of the 75% user consumer base here at Sanford that leverages data day in and day out for their operational necessity, financial necessity to keep the business moving forward. And so we needed something that was scalable, flexible, faster, secure and compliant, but also has the ability to be governed, large scale deployments, and then also starting to think, based on our experience with data science and AWS, the impacts that Gen AI, LLM functionality, and how they're changing data and analytics, AI development, daily workflows operationally. The only way to deploy these consistently, repeatedly in a governed manner was really via the cloud. So that's the direction we went.
All right, so let's lead into maybe 2024 and look at what that came about in terms of the SAP HANA device was obviously ripe for replacement, as you've said. For everyone here, you've already been doing a lot of work in that AWS model and pushing ahead with that. So tell us a little bit about what the evaluation was like. How do you get around to doing the cloud data warehouse as your main platform?
Yeah, I think it's important to note, and we can address this later on in some of the other questions, This isn't something that happened overnight. The data modernization became a focal point, essentially the start of 2024. Our main goals were to provide AI analytics, factory, enterprise automation, price, contractual transparency, and then digital front door. So we had to start looking at not just a cloud data warehouse solution, but what does that really mean all in? And there has to be a further evaluation of not just the tools, but as you get to the strategic considerations, what do we have for people and skill sets to implement those tools outside of the data warehouse itself? What is everything else that it takes to facilitate the development and enablement of a data warehouse scenario? And then as what is our change management? What is our game plan? So it was really I'll say, enterprise level strategic plan coming from our executive level leadership. Healthcare IT leaders really stepped in for us as we dug deeper and did more of our own research. It's not as simple as just best of breed. The interoperability of these systems, not just within your EHR, but how they speak and coordinate with each other, is really a data ecosystem, not necessarily having one piece that's more valuable than the other. They all have to speak and work together, and they have to come in at an appropriate cost point. So there was a year's worth of evaluation and work done before we started making any decisions.
Dane, when we were talking last week, I kind of teased you a little bit and said, you guys are smart. You could, in theory, have done this all yourselves. And I know from my own role in this project, sometimes I felt like we were gathering together what you guys were thinking and presenting it back to you or bringing extra perspective. So for people out there who are listening to us, I guess a lot of them have teams, maybe they don't have all the team that they need. So what difference did you feel it made to have people like ourselves come in and work with you through process last year?
Sure. So while we did have some experience in the cloud, we did not have experience cloud at scale. So I think it's important to note that we needed the reassurance that the tools that we were selecting would work. And it's not just about would they work. I mean, we've never sat on a vendor call and watched a demonstration that didn't work exactly how they told me it was going to work. But being able to ask the why and the how of an independent party was also very important to us. And also the experience of being there and done that, if you will, played an important role in the assurance that the direction we were moving forward was appropriate, as well as the guidance that's key to all of this in creating your roadmap. It doesn't all have to occur at once. So what is that timeline and sequence of events that help you build your business plan?
I'm with you. Let's jump into some of that specifically. For many people, this will seem like a softball question, but when you began strategy and planning, I guess there's that question is who absolutely needs to be in the room and who tends to get left out?
And I think when we were doing a review, I think my comment was it's probably easier to identify those that maybe shouldn't be, because from my opinion and my experience, everyone should have a voice. This is very resource intensive. Even if all people are not directly tied to the technical aspects, they will be tied as part of the data integrity as the segment experts with how it's built. Is it built appropriately in the governance surrounding it? So I strongly believe IT, legal, compliance, finance, HR, supply chain, data architecture, engineering, marketing, finance, your governance and subcommittees all should be given an opportunity to voice their opinion and or concerns. I also think it's key for the change management aspect that often gets left out. This type of technology, architecture, modernization, a lot of your ROI is going to come from consolidation of other applications that are going to directly impact those downstream. And it's important to have those conversations before it's, hey, we're going live next week. So being able to do that in a timely manner, teach them the fix, work with them on how it can be done better, becomes important conversations. So they all need to be involved on the ground level. At least that's my thought.
I'm with you. And maybe I'll kind of pose that kind of commonly overlooked group and say, kind of to your point, is there anyone who did crawl out of the woodwork a little bit later and you felt like I wish they'd spoken up sooner?
I think security was one of the big topics of discussion that I wish would have occurred earlier onset. But otherwise, I think we did a pretty good job effectively communicating with the group. If they weren't part of the conversation, they were at least very well communicated with as far as what was going on. Being at a strategic plan at our C-suite, even if they weren't directly part of the meetings or conversation discussions, they all had ways or were given ways to facilitate and uplift questions or concerns that they may have. I would say to that point, I wish more people would have voiced not necessarily concerns, but maybe use cases or their thoughts surrounding it, or ask the questions of how it could make their lives better or how this could successfully impact their day-to-day workflows earlier. Those are questions that we're having now downstream, which is causing a little bit of prioritization discussions that we thought we had worked out beforehand. But it's all positive. That's the worst thing that came about.
And yeah, it definitely sounds positive. It didn't sound like any gotchas in any bad sense.
Right.
I think that kind of leans into our next group of ideas here and questions is, looking at, you just mentioned use cases a second ago. Obviously, data is going to be critical and your leadership alignment. So for you guys, like, what do we mean by AI readiness? Like, what does that actually mean for you in a hospital setting?
I think it's the understanding that we've reached the turning point, that there has to be an investment and a strategic plan and a willingness to invest in these types of tools that ultimately enable the true value of data and analytics. So it has to come from the top down, first thing. I think there needs to be clear expectation in that AI isn't a magic 8-ball going to solve the world's problems. I think there has to be an understanding of change management, and that has to be well organized, particularly with any sorts of applications or workflows that may be sunsetted. And I think there has to be, before you start looking at vendors, I think it's most important to start looking at your people and skill sets. And then the understanding that governance has to play a prominent role, not just in the technical infrastructure or the ability of your data ecosystem to be governed. It's around the people governance that will have impact and guidance to create those rule sets. The data stewards have to realize, as an organization, data governance has to be a prioritization to make this work well.
And just looking at clean and governed data, and I think you shared with everybody, a lot of what you have is coming out of your Epic. It covers most of your locations. What about data beyond that? Because I think you can say with something like Epic, it's not going to be perfect, but you've got a very structured data set. What about your other data sets? Where were you in terms of how clean that was, especially since you'd already been using your AWS platform?
So I would say even with Epic, there's some data cleaning, data integrity issues that need to be addressed. Yes, Epic is top tier EMR, EHR, whatever you want to call it, but there's ways to customize it. And there are ways, even within our various regions and service areas, that customization has occurred. So within there, and that customization occurs whether to align with maybe different GL structures that may occur, different preferences as far as workflows, but those all have to be addressed. Those then lend themselves to the additional tool sets that may be necessary, even AI capabilities in those data governance tools to help align and transform that data, as well as specifically call out instances where data may not be ETLing or pipelining appropriately. So I think that's something that has to be addressed across all fronts. With the external data sources, and we'll get into this as some more of our future state, it becomes more aligning with being able to connect the disparate data systems to create a patient profile, for example. Here at Sanford, we have healthcare. So we have hospitals, we have clinics. We also have our health plans. So we have members. We also have durable medical equipment. Sanford Equip, it supplies whole medical, durable medical. They don't all speak to each other. They're all on different softwares, versions of EHRs. You mix in our long-term care and SNF facilities, how we integrate those and how we align those becomes very important. And without tool sets like these are nearly impossible. And that's without even thinking about like our digital transformation, our CRM type data, external data, retail pharmacy type data as well.
You got a lot there. Dane, before we transition to the next question, which will kind of look at some of the prioritizations, you've given us a lot of information about the different platforms. What does that mean in terms of use cases? I always think at a hospital, depending on what floor you're on, it's a scheduling system, it's a staffing system, it's a revenue and billing system. Some people actually deliver healthcare. What type of use cases are you talking about here?
Sure. So the way we prioritize things was going back to HANA as one of our primary data warehouse that we know needed to be sunsetted some way, shape, or form. Doing an evaluation of the data currently being dumped into that device. Some of that was being done because PCC, for example, is the EMR for our long-term care SNF facilities. It's not very robust from an interoperability standpoint or even operability from finance, rev cycle, so on and so forth. So the sooner we can start to migrate that data, that takes priority. And really from there, it started to focus more around our business plan, which had to do with the return on investment on consolidation of applications. So that's currently the method that we are following. But then it will then transition to a little bit more of using AI as an example. We have the ability, although a little bit siloed within our data sources, but there is data engineering capabilities through AWS and its ecosystem that we're able to do it. It's not perfect by any means, but we are able to do it. So that's going to have to find its way in prioritization.
Are your use cases long-standing use cases, or how many people do you have lining up because they want to do AI because they've heard nothing but AI for the last 6 months? What type of other use cases are you seeing?
I would say these are more long-term use cases, not AI specific. At this point, we're getting there, but a lot of these resources are knowing we have this type of technology. Do we necessarily need to pay a CRM vendor? If we have PCC, but we really can't align that with other data, so it makes it difficult from a patient being transferred from a long-term care facility into an acute hospital setting and then back and forth. There's AI that can play into that. We can make risk identifications of people, at risk of re-identification, but we can handle that through our AWS platform. But overall general data needs for PCC, I just need to get that data in a place that can be more easily reportable for the day in and day out operations.
With you, and I think that kind of goes back to why do we go to the cloud? Because it gives you a common place to stage all of that.
And just to give you, again, size and scale here at Sanford, not all of our mergers and acquisitions are these, large use cases that hit Becker's or whatever publication. There's a lot of smaller independents that are joining Sanford. Right now, the last number I heard was we had roughly 90 different EHRs that were sitting legacy on different servers sitting there, some very old, sitting in non-compliance, that we theoretically hope if we need to for legal obligations or otherwise, we hit the switch and the light comes on. We know that that's probably not the appropriate way. This type of technology allows for cold storage as well, not just the day in and day out activities that are needed to run a business. It gives us a safe, secure place to land legacy systems.
So if I recap, what I just heard was just a whole spectrum of different use cases. It's not just a single one coming at you.
Correct.
All right. So I teased out that extra question there because I think one of the obvious questions we start seeing is, as you do this data in the cloud, as you look at AI, I think just for everyone's benefit, you probably hit us with a dozen different things going on there of classic data in the cloud, some AI opportunities for risk, for readmission, all the kind of classic stuff we watch out for us. So talk to us about that. How do you prioritize your AI and data investments? You've a lot of health going on, like with budget constraints. So how do you plan that?
So the first thing I would layer a second question underneath this that would give two different answers. First would be for the people on this call. Are you thinking build or buy? So again, going back to a centralized data and analytics department, we have a large formal IT department. It took us a long time to get there, a culture shift, but I think we are to a point now, at least from an AI perspective, people are coming to us asking, this is a vendor that we are looking at. what would be the lift or resource intensity if we were to build this? Do we have the capability to build it internally? Or should this be something we're looking to buy? And some third option with some partnerships that we had built. I think if you're buying something, the ROI is a little bit more straightforward. And I know I'm oversimplifying this, but are you getting what you're paying for? And you know that going into it. If it's quantitative, you're going to have hard dollar savings, or if it's something quality driven, which can be a little bit more challenging. Sometimes there are dollars tied to quality reporting, external quality reports, either through CMS or otherwise. If you're building, then it starts to become the resource intensity. How long is it going to take? The complexity that's going to take. The benefit, I guess, with the building part is you're ultimately in control. So how well can your team perform? It's easy to calculate the labor dollars, but if I can build, say a vendor has this shiny new toy over here, I can build it much cheaper, but there might be 10% that I can't capture to get the full build out. Is the organization okay with that 10% gap at the price point I can provide it? So those are all questions that I think come into play, but with limited budgets, you do what you can. And then the early ROI, I think, particularly from an AI perspective, and we could talk about this more, but what door do you want to stick your foot in? Where do you want to focus? Anything typically clinical facing is one, more expensive, and it's longer time to value. And the operationalization portion of anything clinical is much more significant than if you're looking at doing some sort of AI or agentic process automation in back office rev cycle. So I do like, start small, show your value, start to win over your champions, show early ROI. Going back to the automation, the project doesn't have to be 100% automated. If there's still a portion, 20% that requires a human in the loop or anything like that, or it's only for 20% of the payers or payer portals, for example, that doesn't mean you have to wait to turn that on. And then I do like the phased roadmap, whether it's a small project or a large project. I think there are solid investments that can be made that, while you say it's prioritizing AI and data investments, it's really how do you capture the largest return on investment.
I'm going to say something and show my age here. When I first came to the States in the early 2000s, and anyone I was working with, like Covance, and they were investing in technology, it was like tens of thousands of dollars up front because we're buying new servers, new storage. I think one of the things, especially for people earlier in their cloud journey, is you're changing that over to a monthly billing cycle. You guys have it with AWS, you have it with Snowflake now as well. Does that change your perspective where you've got a slow ramp compared to kind of, I'll call it the old days where it was like all dollars up front and these new shiny servers and storage was delivered to your data center?
Yeah, so a little bit of insights there. Having a lot of experience on AWS, I'm highly impressed with the cost effectiveness of using AWS and its cloud native tools, particularly with AI, particularly with the use of SageMaker that we leverage for most of our data science activities, and very, very impressed with the cost effectiveness of the AWS Bedrock, which enables their LLM function. Some of that has to do with how you use it, of course, with all the LLMs, all the generative AI that's out there. Yes, you can go straight to the top end of those price points, but you don't necessarily have to. And it's affordable enough that you can do some testing to find that right price point to get the accuracy and precision that you need for the right dollar amount. Without, to your point, yeah, you don't have to load up on a whole bunch of hardware. You're basically paying for what you use. You don't want to use it, you don't have to. So it's all up to you as an organization. It's easy to, in my perspective, to create the estimates. Now, when you're going to say a vendor, you have your hyperscalers, then you get down into your Informaticas, your Snowflakes of the world. There is a big difference and a big jump in price point. That's something that is just there. So I think you have to be a little bit more conservative once you get down into those more catering, data warehousing, AI enablement vendors. And it's just not all the warehousing, it's all the tools that surround it.
Yeah, and I think as you're saying that, what comes to mind for me is I can think of other clients of mine where, yeah, I've got an AWS stack, but I want to do data sharing with third parties. Well, you know what? My Snowflake has that built in. It's part of the functionality. It's part of my vendor evaluation. Sure as hell I could do that with AWS, but now I've got to configure everything soup to nuts to make that happen. So I think that's part of the trade-off, as you describe that, is there are utility tools, and AWS is full of that to build it up and stuff. And then other times, I think you're probably going more wholesale and kind of going for larger chunks that have blocks of functionality that, yeah, you could have 18 developers work on something and get there in 18 months, or you can kind of use some of the larger tools, and that helps you get to kind of functionality that's already baked into a platform. But as you say, it's the next tier of platform to get there.
Yep. And it's part of picking the right tool to do the job.
In terms of picking tools, let's kind of ask that question. You've described for everyone here your data ecosystem. I think the way we could describe that is you've got the data wrangling part of your AWS, you've got legacy systems like SAP HANA you're turning off, you've got Snowflake you're ramping up, you've got other AWS uses on the far side of that. So where are you on your roadmap? I think, we saw a bunch of different people when we asked the questionnaire at the top. Where are you guys today?
I would say right now it's a combination of the SAP HANA replacement and the additional quality type metrics. Shortly thereafter, I'm going to call it all things people. So it's patients, it's members, it's employees, and it's providers. So being able to identify a patient 360-degree view, meaning how do they interact with our clinics? How do they interact with our hospital? How do they interact with our long-term care facilities? How do they digitally touch Sanford? Allows us, I think, some of the best ways to, you hear it called precision medicine. I would say more precision delivery of medicine to the individual, where they need it, where they have easy access, when and where and how they want. The same goes even with our providers. So something as simple as provider specialty is housed in, give or take here, 6 to 8 different sources of information, whether it be our Workday, which handles most of our HR, our credentialing system, our third-party vendor that does some of our web engagement. So how do we find that golden record, if you will? It becomes very important. So it's all of these. I would say the intensity with which how you're able to progress is a little bit different. The beauty of like SAP and the HANA replacement, those are more straightforward because there were already data integrations occurring. Things like your provider or patient 360, there has to be more governance around and structure around what is included, what isn't included. Even things like one of the first slides we looked at, active patients. Different health systems consider active patients or attributed patients differently. There's different methodologies. And that's okay. But we need to be able to account for that in order to build the rule sets before just dumping a whole lot of, I'll call it data, which I don't necessarily consider information, into a data warehouse, and then have the expectation that we're going to be able to follow some sort of medallion methodology to get it down to just what we really want. Well, we need to follow that exercise in utility beforehand.
Yeah, I'm going to go for an awful pun here and say, the idea that we're going to earn Olympic medals for our data work, I think we got to think like athletes. You just don't run 100 meters and get a gold medal with data. I think by the time you get to a gold layer in your Snowflake, you've done a lot of work for cleaning and wrangling to get it there.
Right. Very much so.
All right, Dane, thank you. At this point in time, I think we've been talking a lot and we want to give some other people an opportunity as well here. So we're going to turn the floor over. I'm going to transition screens here so I can actually see what questions you guys are putting in the chat.
And Connor, you can see, if you want to stop sharing, I can pass them along to you both. There's some in the Q&A and some in the chat. And I'll just talk from here. Dane, with your hybrid model, what's the ratio of analytics that are currently sourced from your cloud versus on-prem? Yeah, that's the question.
So all of the data science goes through our AWS cloud platform. Overall, as a volume of overall data and analytics, I'm probably going to put that at 5%. Now, I will say within our AWS platform, we also do integrate in a productive state our data and risk models back into Epic through HL7 messages. So it is a productive state. It is an environment that we use heavily and does carry significant value. Now, prior to EDA being formed 10 years ago, we leverage SAP Business Objects. And prior to us merging, we had somewhere between 45 and 50,000 different queries that sat out there. We then had to purge that down. It was purged to, I think, 8,000 at that time. Today, we've climbed back up to 10, 12,000. But I can't even tell you the number of users that hit that platform day in and day out, and the amount of data. Like, I don't have a number of terabytes of information that flow through that on a daily basis, but that is our primary source of data information analytics being shared. And I will couple that over the last year, there's been a dramatic shift in Epic and its capabilities within its analytic catalog and slicer dicer functionality. So as opposed to taking the data from Clarity, their database, you don't have to have people log into a different system. You also don't have the downtime of an additional application, nor do you essentially have to worry about the integration into Clarity. It all is sourced through Caboodle. It's very customizable. So that is something else that formerly had been more on the IT side, that in the last year and a half has transitioned to EDA. So if I had to guess, I would say 5% AWS. I'm going to say 20% directly through Epic, and then the remaining goes through Business Objects, which is on-prem.
Got you. Dane, one of the things we talked about, was kind of where you were in your evaluation. And everybody looks at what everybody else is doing. When I was at VA, we were always watching what the DoD were doing. In Philadelphia, every major hospital group watches what every other major hospital group is doing. What did you do in terms of your peers? Did you have an opportunity to talk to your peers about where they were and how that was going for them?
Yeah, and it was perfect timing. So as part of our data modernization, we're also looking at ways to create revenue generation scenarios here at Sanford with our data and do it respectively and in a governed manner. We were approached and partnered with a group called Dandelion Health. To date, it's us, Sharp Healthcare out of San Diego, and Texas Health. Sharp was at the forefront. A gentleman named John McManus was running kind of their data and analytics show and data science. They had a ecosystem set up. It wasn't exactly the same as how we had envisioned. They had a more federated data ecosystem than ours. So there were some differences there, but the technologies and how we could enable it, what were some of their trials, tribulations, we were able to talk to both of them about. We were also part of different groups, communities, if you will. COVID kind of did a number on a couple of them, but we were still able to find our contacts. Scottsdale Institute. We are also members of IIA, the International Institute of Analytics. All of my leadership here are part of the Gartner CDAO Midwest community out of Minneapolis region. And then we also, I can't tell you how much we appreciate our AWS partner, our business solution partner, Dan Hudelson. They go the extra mile. We meet with them bi-weekly. They help us any way they possibly can, whether, providing us workshops regarding new technology, helping out, troubleshooting our engineering and architecture. So yeah, it's been a really peer-to-peer driven. Now, a little bit more on some of these vendors with creating this ecosystem. Yeah, everyone had an idea, and we were able to meet with our peer-to-peers. But I also really call the reference calls as well. Like I mentioned, you're going to go to a demo and it's going to work exactly the way they tell you it's going to work because it's teed up to perfection that we all know is not a reality. And it can't be, oh, that's nice, it worked. It has to be more about not just what it does, but how does it do it? What are the internal workings and why does it work the way that it does? And then hearing from those reference calls, and important to note on the reference calls, we've experienced it a couple of times where they've tried to set up a reference call with somebody that just doesn't size and scale to us. And that just doesn't work, to be quite honest. And then in later discussions, you find out that they technically don't even have the ability to process that amount of information. So it just becomes a waste of everyone's time.
there. One last question. I promise this is our last question. We've got people here at different stages on their journey. And I think the obvious question is, if you could go back and change something, I'm not wishing on you to do it all over again, but if you kind of look back and say, is there one thing that comes to mind from a year, 18 months ago, and you're thinking that would have made a difference?
That's a tough one because hindsight's always 20/20. And I think ultimately setting realistic expectations was something that we should have done differently. Understanding the benefit of going the route that we have, asking the right questions, working with health. We did this with you guys as well. I mean, we went well past our kind of timeline for our discussions with you guys because we did want to get in the weeds. It was great getting your recommendations, but we had to know the why and the how as well. So you had to provide in-depth technical insights for us, and then as well as show us. So going back, I think some of it is to tame the excitement and set realistic expectations internally for the time it takes to make this stuff happen.
Yeah, I think as you say that, what I remember is it was like, what do you guys recommend? Why do you recommend that? Prove to us in a 20-line spreadsheet you're scoring for each part of a question. I think if you look back, I think that was a good thing that you did because kind of to your point, it's like in a sales environment, it's very easy to see a product and fall in love with it and want to do it. But I think what you guys exercised was a level of restraint that says, yeah, I think we're there, but help us confirm this decision. I think that's certainly my memory of last fall, was you guys really wanted the assurance that this was the right thing.
And completely, and I'll add the timing of that also became a question that I don't know that we were necessarily thinking about the way that we should. And that timing and that sequence of events is still going on today. A good example of it, what good does it do us to we sign a Snowflake contract, and I'm making these timelines up, say the beginning of this year, and we're figuring out our data pipelining and getting data in there. What good would it do us to sign a data governance contract when there's no data governance even in there available to govern? Why would you sign a master data management agreement with another vendor when, again, there is no data to manage? And you are also seeing such a quick evolution of these tool sets. Even Snowflake, for example, starting to cultivate, that functionality within their own application. So it starts to become where and when do these come into play? It can be a phased approach. And I would say don't sign anything until you know that you absolutely need it.
And Dane, I see one of my professors on here, and we've got a classmate who retired out of making software for satellites. And what we always come back to with him is if you started now compared to technology 6 months ago, you'd actually get to the answer faster than where you are. So I think sometimes it's very easy to get there. Peter, thank you so much for setting all this up for us. It's been fun talking with Dane. So I want to thank you as well, Peter, for helping us for the last hour.
Yeah, thanks again to everyone for joining us today. A big thank you to our presenters, Dane and Conor, for sharing valuable insights on Sanford Health's journey. We hope this session gave you a better understanding of the practical steps, stakeholder engagement, and strategic investments that go into building a modern healthcare data infrastructure. If you'd like to continue the conversation or explore how healthcare IT leaders can support your cloud or analytics initiatives, we'd love to hear from you. Thank you again for your time and have a great day.